Hi, Doreen Armstrong-Ross, President and CEO of the Dryden Regional Health Center, with an update for you today, April 16th. Dryden remains with just the 4 positive cases at this time. All 4 of those cases are considered resolved. It's really important to remember when you hear numbers of cases that those numbers are only really accurate when they're said or published. We are testing people daily. We're getting results back day and evening, and that number can change at any time. But right now, we still just have the 4 positive cases that are all resolved in Dryden. What's been going on at the hospital in the last few days is a real focus on ensuring our physical environment is ready for any positive COVID-19 and presumptive COVID-19 patients we may see. So we are looking at our areas, our care areas where those patients may come in, and ensuring that the physical environment is set up in such a way that those patients can be cared for very safely, and keeping them safe, keeping the other patients in the area safe, and the staff safe. We've done some movement of supply rooms, that sort of thing, just to ensure that we can do this in the most effective way. Starting tomorrow, something our staff is going to be working on is doing mock exercises. So, having a patient, a mock patient in the ER, and taking them through to their admission to the unit, and working through as a multidisciplinary team with physicians and housekeeping and other people, how this will look, how this will work, how we'll move these patients to keep everyone's as safe as absolutely possible. And this is a really good time for staff to look at where there's processes that we can do better, and things that we may need to change up a little bit to ensure that safety. It also gives the staff a comfort level when a real patient comes in, that they know what to do. They're very confident. And we do this a lot outside of COVID. We practice, our code blues, so our cardiac arrests. We practice those. We practice even our missing patient, or internal disasters. We do mock codes throughout the year, and this is just something we're doing specific to caring for COVID-19 patients. Provincially, there is a lot of talk about the numbers, and they are not as high as we had feared they might get, which is really wonderful, of course, but also speaks to how well we've done with the measures to flatten that curve, to plank the curve, and the social distancing, the um, cough and sneeze hygiene, the quarantining, the physical distancing. And it's very important to understand, though, that we need to keep these up to ensure that we do not get a spike. It's not the time to say, oh, there's not the cases, we can loosen up on these things. We can't. We really need to keep going until we are sure that it is safe to change these things. And that's, the things the province is looking at on a daily basis, and making those decisions. We want to take this opportunity, as we always do, to thank the community for their support. As our services have, changed, and are being offered more by phone, to our visitor restrictions, to the generosity that we've experienced in terms of supplies, PPE that people have donated, and money, and the food that comes for, as thank yous to the staff. We really appreciate that. We are offering and welcoming the community to put signs out on our front lawn now that the snow is melted. So when staff come to work, they see the offers, or the thanks and the support that they're getting from the community. So please feel free to do that if your family wants to make a poster and put it out on the front lawn, so the staff, coming to and leaving work can see that, and it helps build them up and make them feel supported by the community. We also want to support our patients, and there's a lot of services that we're not doing, but there's a lot going on in the community. We're going to tag in the comments a lot of phone numbers for assistance that you may need, whether it's around food, mental health, all sorts of support that's out there right now. And we'll put a bunch of numbers in the comments below so you have access to that. It's a hard time, and you need to feel comfortable with reaching out if you need help. Things are different. It's harder to go places. It's harder to get your groceries. It's people aren't working, and if you need support, please reach out and get that help that you need. That's about all my update for today. So thank you very much for listening. And again, stay safe. Keep practicing those things that are keeping us all safe, that are keeping the number of cases very much to a minimum in our community. We appreciate it, and we really need to keep going. Thank you.